In the 1990s, two important documents in global health emerged. The first one is the Global Burden of Disease study that was released in 1990. This is the first ever comprehensive global and regional assessment of mortality and morbidity from major diseases, injuries, and risk factors. This is an important document because it helps shape global health prioritization in the years to come. It was updated twice, first in 2004 and most recently in 2010. The other document was released in 1993 by the World Bank. It is the first World Development Report focused on health matters. Entitled Investing in Health, this report signaled World Bank's commitment to addressing global health issues. This document examined the interplay between human health, health policy, and economic development. It contained many policy prescriptions, but one of the suggestions or recommendations was the use of the Disability Adjusted Life Year, or DALY, as a new metric for morbidity and mortality. Again, this DALY, among other metrics, will be discussed in a future session in this course. The impact of the World Development Report 1993, as well as the different structural adjustment programs that were imposed by the World Bank on many countries, was huge. There were cuts in public funding for health, privatization of healthcare services, promotion of private health insurance, introduction of user fees, and rising costs in healthcare services overall. The following year, in 1994, in Cairo, there was held the International Conference on Population and Development. This is also a very important conference because it recognized the importance of addressing reproductive health and rights, as well as the role of women and gender equality as cornerstones of population and development programs. This conference has been the basis of many efforts by different UN agencies, such as the UN Population Fund, and many countries that have been supporting efforts in reproductive health and gender and women empowerment. Another important milestone in the 1990s is the emergence of the World Trade Organization in 1995. The WTO is the successor to the General Agreement on Tariffs and Trade, which is the mechanism that has governed international trade for many decades. But WTO expanded the reach of global trade to include internationally traded services such as healthcare and health workforce, and also intellectual property. And of course, this made a huge impact on access to medicines, especially in the developing world. With all the developments in the 1990s, and with the fact that the vision of health for all was never achieved in the year 2000, civil society organizations decided to come up with a collective response and gathered in Bangladesh at the first People's Health Assembly, which led to the founding of the People's Health Movement and the drafting of the People's Charter for Health. This charter laid down a comprehensive analysis of the political economy of health, and at the same time listed key recommendations and demands for economic transformation, the protection of the environment, the provision of publicly funded healthcare services, among others. On the other hand, inside the halls of the United Nations, governments were negotiating what we now call the Millennium Development Goals. These goals are meant to be achieved by countries by the year 2015 in a 15-year period. And while all the 8 goals are related to health, 3 are specifically addressing health issues such as the reduction of child mortality, the improving of maternal health, and the combating of HIV/AIDS, malaria, and other diseases. These goals have shaped national policies as well as programs of UN agencies. And now we are in the process of reviewing the gains as well as the lessons that we can learn for the future development agenda. After the crafting of the Millennium Development Goals, the United Nations in 2001 called for a meeting to discuss HIV/AIDS. It is important to remember that HIV/AIDS is the first health issue to be discussed by the United Nations General Assembly. The summit laid down firm commitments on a wide range of issues, including the prevention and treatment of HIV/AIDS, as well as addressing the needs of vulnerable groups that are often afflicted by HIV/AIDS and who also suffer the stigma associated with the disease. In addition, in 2001, WHO, under the leadership of then Director General Dr. Gro Harlem Brundtland, created the Commission on Macroeconomics and Health. And this commission emphasized that health is a creator and prerequisite of development. It also recommended the extension of coverage of health services as well as of a small number of critical interventions to the world's poor. And these interventions are actually proven to have the potential to save millions of lives. Since the release of the report of the Commission, there has been so many developments, especially in the financing of such interventions. For example, the G8 played a more prominent role in global health, from creating the Global Fund to fight AIDS, tuberculosis, and malaria in 2001, to making pledges on a wide range of issues such as health system strengthening. Moreover, the Bill and Melinda Gates Foundation became a key global health player and a source of global health funding. For example, it stimulated the creation of the Global Alliance for Vaccines and Immunization, or Gavi. Since then, more global health initiatives and partnerships emerge, which included in their governance the private sector, foundations, and civil society alongside governments. Despite the growing attention and increased flow of financing and resources for global health, health inequalities remained a huge problem between countries and within countries. Therefore, in 2008, the World Health Organization released the report of the Commission on Social Determinants of Health. And the Commission attempted to answer the basic question, what good does it do to treat people's illnesses only to send them back to the conditions that made them sick? Social determinants of health pertain to the conditions in which people are born, grow, live, work, and age. And the report clearly stated that an equal distribution of health-damaging experiences is not in any sense a natural phenomenon, but is a result of the toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. Therefore, the Commission crafted 3 overarching recommendations to address this problem. First, through improving daily living conditions such as sanitation and housing. The second is to tackle the inequitable distribution of power, money, and resources through reforms in international financing institutions and in global trade. And the third one pertains to measuring and understanding the problem and assessing the impact of action. So how we can enhance monitoring progress in acting on the social determinants of health. Also in 2008, the Director General of the World Health Organization, Dr. Margaret Chan, made a call to return to Alma Ata. This is in part of the 30th anniversary celebration of the Alma Ata Declaration. And during this year, WHO released a World Health Report entitled Primary Health Care Now More Than Ever, which laid down reform priority areas in delivery, in leadership of healthcare systems, in financing to achieve universal health coverage, and addressing public policies that impact on health systems and health outcomes. This was supported by the development of a framework for health systems, the so-called 6 building blocks of a healthcare system, which included governance, human resources for health, health information systems, service delivery, health financing, and medicines, technologies, and devices. This is a very important framework for action for governments, for civil society, and any actor that wants to contribute to the strengthening of health systems worldwide. In 2010, WHO again released an important report, this time focusing on health financing, and this served as the basis of reform priorities towards the achievement of universal health coverage that is now growing momentum. In fact, nearly 100 countries are now racing towards the finish line of universal health coverage in order to ensure that their people, that populations have access to essential health care without the risk of impoverishment due to catastrophic health spending. Even the Director General herself emphasized during the 65th World Health Assembly in 2012 that universal health coverage is the ultimate expression of fairness, and universal coverage is the single most powerful concept that public health has to offer. Universal health coverage is now gaining traction even in the ongoing discussions on the post-2015 development agenda. We know that the Millennium Development Goals is nearing its end in 2015, and therefore the world, the United Nations, the global community is discussing about what's next after 2015, and universal health coverage is definitely at the center of the table of global discussion. And I would like to encourage you by closing with a quotation by a German philosopher named Arthur Schopenhauer. He said that health is not everything, but without health, everything is nothing. Thank you very much, and I look forward to working with you in the future. Bye-bye.